Hello everyone, welcome back to my channel MK Medicine. Today we will discuss about Gerd, means gastroesophageal reflux disease. It is also known as reflux esophagitis. It refers to reflux of gastric content to lower esophagus, resulting in esophageal irritation and inflammation. Simply, GERD is condition in which gastric contents, which also have acid called hydrochloric acid, come to lower esophagus, and these gastric contents which have acid also cause the inflammation of esophagus. Now, pathogenesis of GERD. It occurs because of incompetent lower esophageal sphincter and also because of inappropriate relaxation of lower esophageal sphincter. Now the risk factor of GERD. One of the risk factors is sliding hiatal hernia. In this hernia, stomach slides up into chest through a small opening in the diaphragm, so GERD occurs. Number second cause or risk factor is delay gastric emptying. Means when food remain in stomach for a longer time than normal, it will come to esophagus and GERD occurs. Third one is decreased tone of lower esophageal sphincter. Due to hypothyroidism, CNS depression, pregnancy, alcohol, and tobacco. These things decrease lower esophageal sphincter tone and gastric content comes to esophagus and cause GERD. Clinical features of GERD may be esophageal features or extra-esophageal features. Now, esophageal features caused by GERD, heartburn, and regurgitation are major symptoms. Heartburn is provoked by bending, straining, or lying down. And third one feature is dysphagia. Now, extra-esophageal features of GERD. It includes atypical chest pain, chronic cough, hoarseness, laryngitis, and recurrent chest infection. Now, diagnosis of GERD. Diagnosis of GERD is based on history and empiric trial of PPI, and we also perform endoscopy. It is investigation of choice. It is done when there are alarming features, like when patient have anemia, weight loss, sign of obstruction such as dysphagia or odynophagia along with GERD. And we also perform manometry. It showed decreased lower esophageal sphincter tone in GERD. And we also perform 24-hour pH monitoring. It is one of the most accurate investigation, and it shows the pH in the lower esophagus, and if pH is low in lower esophagus, diagnosis of GERD is confirmed. Here is treatment of GERD. First, we suggest patient lifestyle modification like weight loss if patient is obese. Avoid alcohol, nicotine, caffeine, chocolate, mint, and we suggest elevate head of bed 6 to 8 inch. Avoid large and late night meals. Now, pharmacologic treatment of GERD. H2 blockers include cimetidine, ranitidine, and famotidine. H2 blockers are given in GERD when there are mild or intermittent symptoms. And second one is proton pump inhibitor. Include omeprazole, lansoprazole, and esomeprazole. And we suggest the PPI when there are persistent symptoms or erosive esophagitis. One thing is clear that H2 blockers are given only for the symptomatic treatment. They only cure your symptoms but not erosive esophagitis. But PPI cure your symptoms and also heal erosive esophagitis. Now, surgical treatment for GERD. It is done when symptoms unresponsive to pharmacologic treatment. It includes nascent fundoplication, means wrapping stomach around lower esophageal sphincter so sphincter gets tight and gastric contents does not goes to lower esophagus. And second one is local heat or radiation of lower esophageal sphincter. It causes scarring of lower esophageal sphincter and it gets tight and GERD does not occur. Now here is picture of nascent fundoplication, which is one of surgical treatment for GERD. In this surgical treatment, we wrap the stomach around lower esophageal sphincter so sphincter get tight and gastric contents does not reach to lower esophagus and GERD does not occur. Now complications of GERD. It causes esophagitis. Esophagitis is inflammation of esophageal mucosa because of gastric content. Second one is Barrett esophagus. It's a metaplasia in which one type of epithelium is replaced by another type of epithelium. Third one complication of GERD is iron deficiency anemia. And fourth is benign esophageal stricture, which occur because of acid that comes from stomach to esophagus.